Hello, I'm Dr. Karen with Embrace Life Ohm and Mother Core, and in today's video I'm going to be talking about colorectal cancer. This video is part of our continuing series on light and your health, and to better understand today's show, we recommend that you first watch Part 1, The Basics. For epidemiologists, colorectal cancer is actually a key indicator of economic development. As the country starts developing, we usually see a decrease in infectious diseases and in cancers that are associated with infectious agents, such as cervical cancer and stomach cancer. But at the same time, we typically see a rapid rise of all of the other cancers, with colorectal cancer leading the pack. Today, for every 1 case of colorectal cancer in countries with low economic development, we see 5 cases of colon cancer and 6 cases of rectal cancer in countries that are highly developed. Today in the United States, which is clearly a highly developed nation, colorectal cancer is the second leading cause of cancer death, leading to over 50,000 deaths annually. Now, in 1971, there was a researcher, Burkitt, who noticed the contrastingly very low rate of colorectal cancer in Africa. He made the reasonable assumption that this had something to do with diet, and he noticed the high amount of fiber that the Africans were eating. This became a story that is still told by many today, that eating fiber reduces the risk of colorectal cancer. But in fact, controlled studies have shown that this is not true. Eating fiber does not decrease your risk, and neither does eating a low-fat diet. The only dietary factors that have been shown to link consistency to colorectal cancer after many years of study is that eating processed meats will increase the risk, although eating fresh meat does not, and that eating dairy products will decrease the risk. So eating processed meat does increase your risk of colorectal cancer. However, the amount of risk increase is not nearly enough to explain the tremendous explosion of colorectal cancer cases that occurs when a country undergoes economic development. The issue that many scientists have failed to take into account is that when economic development occurs, there isn't just a change in the food diet, there's also a huge change in the light diet. That is, as economic development occurs, more and more people move to cities and more people work indoors. And as this occurs, they experience much less exposure to bright sunlight. Garland in 1980 showed that this is a tremendous factor for colorectal cancer. They showed not only that cancer rates are much higher in the cities than in the rural areas, but also that they're much higher in areas with low natural sunlight, so low UVB radiation amounts, than in areas with high natural sunlight. For example, in the state of New York, where there's a large urban population and relatively low levels of natural UVB, they would have a rate of cancer that is 3 times higher than the colon cancer rate in New Mexico. The case was made even more compelling by Gorham et al. In 1989 when they looked at the level of acid haze over different cities, which was created by pollution with sulfur dioxide. Sulfur dioxide preferentially absorbs UVB solar radiation, preventing this radiation from getting to the surface. Gorham et al. Showed that cities with a larger amount of acid haze had significantly larger colorectal cancer rates than cities that were less polluted. Gorham et al. Theorized that this was a vitamin D effect, since UVB impacting the skin is necessary for the skin to synthesize vitamin D. But bright sunlight is also important to aid the skin in synthesizing serotonin, which is converted to melatonin after nightfall. So the absence of bright sunlight impacts both vitamin D and melatonin levels, in addition to other important chemicals in the body. So in summary, for studies looking within a developed nation, those who are exposed to the least sunlight have a 3 times increase in colorectal cancer risk from those who are exposed to the most sunlight. However, studies that only look at sunlight exposure in the adult population see a more subtle effect. For example, people who work outdoors all day have only a 10% reduction in their colorectal cancer risk, which is in contrast to the 20% reduction gained with respect to breast cancer. If we look at the light at night part of the equation, because light at night also decreases melatonin, we see that working for over 15 years at a night shift job does increase colorectal cancer risk. But this is in contrast again to breast cancer, where working 1 to 14 years at such a job is enough to increase the risk. So the data shows that while exposure to sunlight during your adult life is important, it's not nearly as important as exposure to sunlight throughout the lifespan. This is powerfully supported by studies that look at the birth cohort effect on colorectal cancer. And these studies find that the year in which you are born is extremely important for your colorectal cancer risk. Medical science has made a lot of advances in spotting and removing precancers, but nonetheless, the year of your birth is 10 times more important than the state of the medical art and the year that you are diagnosed. Some of the most interesting birth cohort data comes from Norway. In Norway, there has been a steady increase in colorectal cancer rates, except for the steep decline seen in people who were born during or immediately after World War II. In World War II, Norway was occupied by Germany and faced severe food shortages. In response, people began growing their own food in the city parks and keeping their own livestock. Doing a little bit of farming sent pregnant women and young babies out into the sunlight. In the United States, we saw the highest colorectal cancer rates in people born in 1890. Subsequent to that, the colorectal cancer rates began decreasing, hitting a low point for births between 1935 and 1955. After that, the rates started increasing again, increasing especially quickly for people born in the 1970s and 1980s, and data is available up to people born in 1990. By the time we get to the 1990 birth cohort, we're seeing the same rates of colon cancer as those born in 1890, which is about twice as high as those born in 1950. And the rectal cancer picture is even more scary, with rates about 4 times as high as people born in 1990 as those who were born in 1950. So today, over a third of rectal cancer patients are under age 50, which is historically unprecedented. Now, in a few minutes, I'm going to talk about why light exposure data, plus potentially another important factor, match the birth cohort data in the United States. But before that, I want to talk about why the year of birth is so important. Now, independent studies have shown that there's different microbiome compositions between people who get colorectal cancer and those who don't. People who don't get colorectal cancer tend to have gut microbiomes with low levels of pro-inflammatory bacteria and high levels of bacteria that make a substance called butyrate. Butyrate is a short-chain fatty acid which is anti-inflammatory and highly nourishing to the gut. People who get colorectal cancer, on the other hand, tend to have high levels of inflammatory bacteria and low levels of bacteria that produce the all-important butyrate. Now, the next important piece of information is that the gut biome of a baby is highly flexible. That gut biome is developing over the first 2 years of life. But after age 2, the gut biome becomes pretty much set. It can be changed after this point with concerted and long-term effort. However, if this effort is not undertaken, the ratio of inflammatory to butyrate-producing bacteria that the child has established by age 2 will likely stay with them for life, thus setting in the risk of developing colorectal cancer at this age. So as you might expect, establishing that healthy microbiome balance by age 2 is dependent in part on light exposure, but it's actually the light exposure of both the baby and the mother. The baby needs a good circadian rhythm to establish a healthy microbiome, light during the day and darkness at night. But since the baby is not producing much of its own melatonin or vitamin D yet, he also needs his mother to be getting plenty of sunlight so that she can pump plenty of vitamin D into his milk and plenty of melatonin at night, as both of these things are very important in establishing the healthy gut microbiome. And yes, if you're using formula at night, that does not have the appropriate amount of melatonin. In addition to the baby's own light exposure and light exposure of the mother, the light exposure of the baby's environment is also very important because the baby picks up microbiome bacteria from the skin of the people who's taking care of it. And that skin will have different bacteria if it's exposed to UV rays and sunlight. And the baby picks up the microbiome from its surrounding environment. And again, that environment will have a different bacteria if it's constantly being exposed to sunlight. So now we understand why proper light exposure during the first 2 years of life for the baby and for the mother is important in decreasing future colorectal cancer risk. And now we can start looking at the birth cohort data in the United States. In the late 1800s, there were a lot of children living in crowded and polluted cities, and the rate of rickets was very high, indicating that they were not getting enough solar radiation. Around 1890, the medical profession made a concerted effort to figure out what was behind the rickets epidemic. As they figured it out, kids started getting a lot more cod liver oil, which contains the needed vitamin D, and they started getting a lot more sunshine as people realized that this was healthy and healing. It is from this era of loving the sun that we got the idea that a suntan was a healthy look. There were a number of things that started happening in the 1950s that had the potential to block the needed UVB radiation. One of these was the introduction of commercial sunblock. Sunblock has been in use more and more from the 1950s through at least the 1990s, and people have been applying it especially to their children. Another thing that happened was the introduction of air conditioning, first inside and then in our cars. When the air conditioning wasn't there, you needed to have the window open on a hot, sunny day, and you especially needed to have your car windows open. With the air conditioning, you keep those windows closed, and window glass preferentially blocks UVB radiation. Another thing, though, that is very important with the birth cohort data is that while we clearly see the increase in colorectal cancer rates in young adults in the United States, the UK, and Australia, the increase is not so strong in Sweden and potentially in some other countries. So in order to know whether any of these explanations are really correct, we need some careful data digging, looking at these different countries and seeing if different uses of, say, sunblock or opened or closed windows actually correlates with the difference in the birth cohort rates. Another possible explanation for the increasing colorectal cancer risk with younger birth cohorts is the increasing consumption of GMO foods or genetically modified foods. Genetically modified foods are treated with an herbicide called glyphosate, which kills the non-genetically modified weeds by disabling their ability to produce amino acids that absorb UVB radiation from the sun. One of the most important such amino acids is tryptophan. Now, industry argues that glyphosate is harmless to humans because we don't use this pathway to create tryptophan. However, there are bacteria in our gut that do. So when we swallow foods that have residue of glyphosate on them, we have the potential of killing bacteria in our gut that make their own tryptophan. Now, studies have shown that if our diet has enough tryptophan in it, these bacteria can use the tryptophan that we eat, and it only produces a minor problem for the gut bacteria. They do recover. However, a baby usually has less tryptophan to begin with, and if they're having formula rather than breast milk, the tryptophan levels are even lower. So having tryptophan-making bacteria constantly at risk in a baby's gut has the potential of permanently altering their gut microbiome. Now, tryptophan is so important because it's the basic building block of melatonin. So we have tryptophan plus vitamin D and sunlight makes serotonin, and then at nighttime, serotonin becomes melatonin. So if we don't have a good tryptophan metabolism, we don't have enough melatonin, and the gut microbiome balance between the inflammatory bacteria and the butyrate-producing bacteria gets thrown off for life. So how can you use the information that we've given you today to decrease your colorectal cancer risk and to maybe treat colorectal cancer that you've already developed? Well, obviously you can have the most impact if you're a pregnant or nursing mother. In that case, you want to maximize the sunlight exposure for yourself and your child. You also want to have darkness at night, because having that sunlight during the day and having the darkness at night will maximize the melatonin that is going into your nighttime milk, and this will maximize the benefit for your baby's developing gut flora. To find out how to have good darkness in your house at night, the proper light bulbs and other lighting to use, please watch part 2 in our series on light and your health. Now, another thing that you can have fun with is that studies have also shown that you can increase the melatonin in your milk by watching a funny show on TV. So please make sure to go for that every day. Now, if you're an adult or if you have older children, the studies show that light exposure is still important. So getting light and getting it consistently over a period of years will still decrease your colorectal cancer risk, as of course will also be decreased by avoiding processed meats. In addition, if you've already been diagnosed with colorectal cancer, the studies still show that good sunlight will increase your chances of getting through your cancer treatment successfully. So whatever stage you're at, please get the sunlight. If you've already been diagnosed, you can also consider taking supplemental melatonin in pill form. This hasn't been shown to actually cure anyone of colorectal cancer. However, it increases the possibility of getting your disease stabilized. In one clinical trial, 30% of people on chemotherapy alone stabilized their disease, while 50% of those on chemotherapy and melatonin were able to achieve stability. So go for the sunlight, increase your melatonin, and don't forget to laugh. Thanks so much for watching today's show.